What up, peeps? I'm sitting in traffic, coming back from Santa Cruz. Got a little drive ahead of me. It's almost 5 o'clock, so it's kind of like rush hour. I don't know if I'm going to beat it or be stuck in it. I got to pass the farms and stuff. So anyway, I figure since I'm in traffic, I might as well do a quick video. I kind of cleaned up my hard drive a little, or my SIM card or whatever it is. Deleted some of the other videos, and so I recorded a bunch of videos that I haven't put up. That's why I haven't been so consistent. I'm editing myself. I don't want to get the channel taken down. I don't want to be too promiscuous or whatever, and I'm not sure where their community standards lie nowadays, so I have to pretty much be conservative and just not put the video up. I'm not editing. If you notice, those of you who follow me notice I don't edit, although we're going to work on that. I'm trying to work on that, so we'll see. Maybe I can do better, because I had a couple of videos that were pretty good, and if I could just cut like a word or two out, or the beginning, I tried to cut the beginning off. There was I was on the radio with Dr. McCullum in a show, and I got 45 minutes whatever on the radio, and because he opened up with the Beatles, we got a copyright strike, and so I couldn't post it. I tried twice. I tried to edit off the Beatles, didn't work. Magical Mystery Tour, those bastards. Anyway, so getting without further ado, this video is for y'all patients that have been x-rayed, or you know, I'm looking at you and telling you your neck is straight without an x-ray, but those of you who we suspect or know have a straight military neck, tech neck, a reverse curve. You should have close to a 45-degree curve. Anywhere, I think, between 35 and 42 is optimal. You CBP practitioners can correct me down below, all right? There's like, there's not too many in the world. That's why I'm laughing. They're few and far between, so, but they are cranking them out. The Harrisons, a couple of engineers, Deed and his dad, you know, they wrote the book on it, right? So, of course, engineers are going to measure the curves, tell you optimal ranges, and, you know, functionality, and it only makes sense, right? So, getting your curves back, like Stella got her groove back, I got my curves back. My neck was straight, too. I can speculate as to what caused it, which is a good practice. It's not an exercise in futility, because if you know what caused it, you can prevent, you know, it in the future, and so prevention is the best medicine, right? So getting your curves back is the title of this video, and we're talking about your sagittal curves, okay? There's three planes in the 3D world. You got your sagittal, you got your coronal, and you have your transverse plane. So sagittal's front to back this way, you know, head back and forward. I'm moving extension and flexion on the sagittal plane. All right, now if I laterally flex my head, I'm moving on the coronal plane, and if I twist my head, I'm moving on the transverse plane. All right, so we need motion in the 3D world in all these three directions, a complete full range of motion. So if you're restricted and you're rotating, which actually I am, and I just got adjusted, so more work to be done. Anyway, you know, we may have to adjust you with more rotation or into rotation. You know, more lateral flexion if you're restricted in lateral flexion, right? P to A, posterior to anterior on the sagittal plane is primarily the way we're adjusting you from back to front. When typically the vertebrae displace or go out of alignment, sure, they can go sideways and twist, but generally, if they're sideways and twisted, they're also going to be stuck front to back. They're usually pushed back a little. And occasionally they can go too far forward, which is bad for chiropractors, because what do? Push them forward. All right. So if they're stuck back, that's 99% of the time. We're pushing forward to free them up, and that'll usually do it. So just the sagittal plane adjustment, right? So the thing is with the adjustments, it's a fast muscle stretch, right? Am I stretching your muscle? Yeah. You've been, you know, rigid, and now I'm laterally flexing your neck and rotating it. We're going to stretch those muscles, right? And if they're real tight, it's going to be uncomfortable. You could even get sore, get a little bit of a sprain strain, not uncommon for chiropractic manual adjusting. And when you take a rubber band, okay, which is the same elasticity as muscle, You stretch it fast, it's going to retain its shape. So if you take a rubber band and just give it a quick stretch, it goes right back to its original shape. If we tack it down overnight, okay, and make it elongated and leave it there for hours, it'll hold a longer shape. It'll mold, it'll stretch, it'll change. It's malleable, right? So are our muscles. We see people changing consciously, their bodies all the time. They do the ear piercings and then they stretch the earlobe, and then you can stretch it all the way down to your feet. Amazing, right? So the muscle's very pliable. We can stretch it and get a lot of room to wiggle. Literally, that's what we want, is wiggle room. All right, if the muscles are tight and short, I might be able to get a fast adjustment in there, get the joint capsule opened up and activated and reactivated and moving again. But we want to get your range of motion extended further and further till we restore the full natural range of motion. Because it affects function, right? And it affects the nervous system. We need that motion to keep the blood flowing, the circulation flowing, the lymph system, cerebral spinal fluid, okay? We need that stuff moving around, pumping into your brain and over your spinal cord. Yes, bringing oxygen and nutrients to all the vital cells, and that's what's up. So yeah, I'm a little distracted here, I'm driving. So muscle elasticity, right? We need a slow stretch to couple with the chiropractic. The chiropractic's good. That's probably the only thing, is putting a force in there to break open that joint capsule, to get the imbibition restored and the vertebrae moving again. You might be able to move your neck, but there might be one stuck vertebrae that's not moving, and so it's not gonna pump the disc, hydrate the disc. It's the movement in between the vertebrae that we call imbibition, which is what pumps the disc, restores, rehydrates, maintains the disc. All right, the disc, somewhat avascular. There's not a lot of blood pumping in there directly, although there's vessels kind of around. We need the motion, right? That's why exercise is so good for you. I'm thinking it's obvious we need motion, but maybe not to everyone. If you didn't know, no, I don't want you to be rigid. I want you to be moving. We need motion to be healthy. Generally, to a limit, more motion is going to be healthier, right? So people who exercise, athletes, are generally healthier, can live longer. All the research shows. Go look it up. All right, so you want your curves back. You want your neck to move again. You want less pinched nerves. You want restored function to the body and the mind and the spirit. Then we got to work on the body, okay? We got to work on those short, tight muscles in your neck. And I recommend to most of my patients who've lost their curves, Posture Pump, posturepump.com. I don't make a penny off of it. I wish I was, but they don't really have, I can't, give you a discount code and you can, they can send me a check, would be nice. But I pump them because they're pumping you, all right? They help me restore my neck curve. Not totally, it's not 100%, but it's way better, right? And I can move my head and not have headaches and migraines, and I can sleep and function way, way, way better. Medical research shows anterior head carriage, once the head starts going forward and it starts pinching the nerves, you're going to have lots of problems. The research literature is filled. They call it anterior head carriage, and they know it affects vagal tone, which is your vagus nerve, which controls blood pressure and heart rate and the autonomic nervous system, the whole fight or flight mechanism, right? We want to turn it off. So we adjust Atlas. Generally, we're affecting vagal tone and, and physiology. So, that's what we call getting the big picture, because the chiropractic adjustments affect, global physiology, affect your heart rate, right? Can maybe help prevent you getting atherosclerosis, right? Lowering your blood pressure. All these good physiological effects that we don't typically advertise because we're not chasing symptoms, right? We're not, globally we want function to improve, but the idea is we just do what we can. We restore the motion to the joints, taking the pressure off the nervous system. So it is our objective to, restore function to every organ, every cell. And we use the spine to do that because it's effective. If there's impotence in the nervous system between the vertebrae, pinched nerves, you're not going to function well. You're going to have weakness, you're going to have paralysis, numbness, tingling, loss of sensation, pain, lot of people come to us for pain, but my patient I just adjusted, he's telling me he can see better right after the adjustment. So, who knew? I don't advertise, hey, we correct vision here at Feel the Light Chiropractic. It's not what we say, but maybe we should be saying that, all right? So tell your friends, maybe chiropractic can help their vision, right? We don't promise it, we don't look for that, but we certainly restore all the motion we can to all the joints, and pray for the best, right? And hope for the best. So the body does its thing, heals itself. All right, so restoring the curves in your neck, obviously important. We want slack in there so the joints can keep moving, and it's a slow stretch. We need to slow it down. 10-minute stretch, 10 to 15 minutes. A muscle gets its maximum stretch at 10 minutes. So if you stretch for 5, you're not getting a maximum stretch. If you hold out for an entire 10 minutes, now that muscle is elongated as much as it's going to go. Then the surrounding ligaments, which attach bone to bone, okay, will begin to stretch. So once you've stretched the muscles and the tendons, which is the end of the muscle where it attaches, now we can start to stretch the ligaments, but no sooner. And if you got really shortened ligaments and you need to stretch those ligaments, whoa, all right, you're probably having numbness and tingling, pain. You're having some symptomology for sure, right, with that pinched nerve. So to elongate the ligaments, between 10 and 15 minutes. So 10 and 11 minutes, 12 minutes, you're stretching ligaments for 2 minutes, right? For 13-minute stretch, you're stretching your ligaments for 3 minutes. And believe me, when you stretch your ligaments, it's going to be a little uncomfortable. You're going to be sore getting up, all right? You're creating a sprain strain. Once you maximum stretch the muscles and continue further, the muscles are going to get sore too. And so you're going to have a little bit of a strain, a muscle strain, and then you're going to have a little bit of a ligament sprain. As the ligaments stretch, they're tearing, right? Little micro tears to elongate. And so that's going to make you sore. If you go too long, you're going to be hella sore. So start slow, start easy. I tell patients 10 minutes 3 times a day, right? 10 to 15 minutes. So you got to work up to it. In the beginning, you may only be able to do 1 or 2 minutes. If you go for a full 10, you're going to really make those muscles sore. You could even, start tearing them and cause injury. So we don't want that. We want to prevent injury. We want to accelerate the healing and facilitate the healing, but we don't want to push it too hard and go backwards, all right? So time, people. How long does it take? How long does it take to get your neck curve back? If you're doing the neck stretching 3 times a day, 15 minutes consistently, I'd say within a 6-month time period, assuming you're getting regularly chiropractic adjustments, which is 1, 2, 3 times a week, minimum, maybe more, maybe once a day, okay? Depending on where you're at. But if you got advanced arthritis, you've been janked for many years, and it's going to take a long time for things to come back. Generally, once the discs are gone and shrunken and disappearing, desiccated discs don't really come back. I mean, once it's gone, it can't come back. But I mean, we've seen miracles, and in the early stages, it's totally restorable. So the earlier we catch it, the better. If you're not seeing a chiropractor, get to one. You want to prevent all this. And if you still have your curve, great. Let's just get a few adjustments in there. If you got any stuck vertebrae, keep them moving. And that's it. You're a happy camper. But, if you've ever been in a whiplash, a car injury, maybe you didn't even feel pain or an injury. You might have got rear-ended, had a small whiplash, not even notice it. I've seen x-rays, patients have, broken vertebrae, they whiplash, compression fracture, the vertebrae. Sometimes the front tips will pop right off, obvious evidence of a whiplash, and they didn't even know. They didn't even know they broke your neck. Sometimes they didn't have x-rays, so you don't have to destroy the car to do that much damage on a vertebrae. Just a good little whiplash can do you. Questions, comments, hit me up down below. Check out posturepump.com. There's another device, it's cheaper. Those go for about $155, $200 for just the neck version. There's a low back one too. I recommend them both. Get them both if you got low back pain. Certainly you want to see your x-rays. Certainly you want a doctor to recommend it to you. But the company, posturepump.com, I'm pretty sure sells it without a doctor's recommendation because it's pretty safe. You don't really need to. Like I say, you could do damage. Be careful. Follow their instructions. They got great videos you should watch. It'll explain graphically, way better than I'm explaining it, but you can see how it's restoring the curves, how the curves are important. And yeah, so that's like another level. If you can't do that, you can get the Dakota, D-A-K-O-T-A unit from Matlin Manufacturing. And where are they? Somewhere in Michigan or something, I'm not sure. But you Google it, and it's like $50. It's a foam wedge that you lay on like a pillow, and it's got a bungee cord that pulls your head back and stretches you back into that curve. It's not like a perfect curve. That's why I think the posture pump is better, but we're getting in the right direction. We're decompressing that neck, opening up the discs, working against gravity. That's working on us all the time. All right. People always ask me about the teeters, the what do you call, the inversion tables, right? Inverting is great for your blood flow. Some people can't take it. Guy told me he had eye problems, and the extra blood pressure, it hurts his eyes, so he can't stay upside down for too long. Now that's linear traction. All right, we want to mold you into curves, so we want to do traction in a curve, right? I think it's curvilinear traction. But if we were just to pull you straight, hang you upside down by your feet, right? It's decompressing the spine, it's opening up the disc. That's fantastic, but it's not going to mold you into those curves front to back on that sagittal plane, right? We're working on a long axis. The fourth dimension. So yeah, just basically making you taller, which is great. We need to do that. We need to decompress, but I don't want to straighten your spine out, right? If you have some curve left and I just keep pulling the head and the feet apart, you're going to straighten out. We don't want that. We want the curves in there, all right? They act like shock absorbers for your neck, for your whole spine. The engineers got to figure it out. I mean, God, the designer, the universe, whoever made this body or designed it, I mean, I don't know if it just randomly evolved. Certainly if it evolved, it wasn't that random, right? It evolved with a purpose, and so we can see it in the design, right? Like an arch or an optimal curve is a very strong structure, and the body uses geometry to function, right? And have areas of strength and mobility, and so the sacred geometry runs throughout. All right, I don't want to run too long on this video. We're coming towards 20 minutes. I think we got a good length. Another note on this, chiropractors, not all chiropractors are the same, obviously, but they get 4 basic classes, core classes, that we all pretty much take, like toggle and upper cervical technique, which is an upper cervical technique, toggle technique, and then we take like a drop table Thompson technique, we take Gonstead, and full spine or diversified, which is the same thing. All right, so we get the 4 basics. All right, then there's electives. People can take activator with the little clicker, BGI. I mean, there's a million electives out there. CVP is the one that I studied with Deed Harrison and the engineers, and it's like, what is it? Clinical biomechanics of posture or something like that, or there's a few different ways that acronym works out, but you get the idea. These are the guys studying the curves and the planes, and measuring to the nth degree, and these are the ones straightening out the scoliosis. The scoliosis is the lateral curve, when you're curving on a coronal plane, your head's tilted to the side. All right, not good. It generally is getting worse. It's generally idiopathic. They don't know what caused it, although sometimes we can figure it out. I personally am an expert on all the causes. I did my doctoral thesis, what was it, presentation? Forgot what class it was. Maybe it was research, I forget. But anyway, it could be chemical, right? So 3 causes are toxins, thoughts, and traumas. That's what causes subluxation, a situation of less light, which is basically a pinched nerve. Interference in the nervous system, subluxation, less light. So that's what we're working on. That's why we're working on your curves. And yeah, so not all chiropractors know about this. And you know, a lot of the chiropractors will even argue on Facebook in my chiro groups telling me, hey, it's not the adjustments that give you your curves back, right? It is that slow stretch, so it needs to be coupled. And I mean, you know, you would think that would be more of a core class that the chiropractors would know, but they don't. I worked with a 75-year-old chiro, was in practice for like 30 years, great chiro, basically arguing with me, telling me you cannot straighten a scoliosis with a chiropractic. And I'm like, dude, I had a scoliosis and they straightened it, and that's why I became a chiropractor. So the argument is semantics, but they're saying it's not the adjustments that straighten the curves. It's definitely part of it, right? If you're locked and I unlock it, typically the body, you know, will posture up and right itself, assuming Atlas is floating free. You have the righting reflex, and it's a self-healing mechanism, so the body should straighten its scoliosis out on its own. You know, but if you want to make the argument that it's not the adjustments, you know, then what is it? Then it was the muscle stretching, right? So that's what the CBP does. They do have other ways of adjusting, and there's exercises, right? So we can strengthen muscle groups on one side and lengthen muscle groups on the opposite side, the opposition, and restore balance, right? That's what the body wants. You know, balance between strength and flexibility, balance of flexibility, right? Like all your muscles need to be flexible. You can't just be flexible on one side. And you need to be strong in balance, and you need to have balance. You need to be able to stand on one foot with your eyes closed, you know? All right, so hopefully you're gonna put the work in 3 times a day, 15 minutes. That's 45 minutes a day. It's a lot of work, people. For a good 6 months, you'll start getting your curves back. It's a game changer. You're taking the responsibility. You're doing the work. I never do it for you. I couldn't do it for you. Your personal trainer cannot work out for you. Your chiropractor cannot fix you. All right? Ultimately, the body heals itself, and we just kind of guide it along. All right? We guide you. The more you take responsibility into your own hands, like I did, becoming a chiropractor, and it's a little extreme. I'm not saying you need to go to chiropractic school to get fixed, but if you just want to be like, oh, I don't care, I don't want to know, and you just do whatever, doc, just fix me. That you're not going to get as good as results as if you're engaged and you're like, hey, you know, what can I do? What can I do on my own, right? I come see you 3 times a week for, you know, 5-10 minutes, whatever. It's a half hour total. Like, what, you know, I'm 24 hours a day on my own. What can I do at home? What can I do? Is there anything? Yes, you can do yoga, you can do stretching, but that could jack you worse, right? So you need to do specific yoga poses, maybe avoid other ones, and, you know, maybe certain types of yoga as well. You know, and then there's the CBP stuff, right? Certain specific strengthening exercises, core exercises, balance, and muscle lengthening. All right, so, I mean, usually yogas are going to be less subluxated. They're easier to get adjusted, but you can overdo it. You can be too flexible too. So, you know, balance. All right, most of my patients are not flexible at all. Super tight, can't move, super rigid. So that's what the focus is here. Get yourself a jacuzzi, get yourself some yoga. Yeah, maybe you need some CBT D for the recovery. I also like kava. Kava is a good muscle relaxer, painkiller. So, you know, when you're getting those sore muscles from all the stretching, you're going to need it. I try not to do NSAIDs, non-steroidal anti-inflammatories, or Tylenol, any of that, aspirin. I don't try to do pills and pill culture. Just take it easy with the stretching, all right? Go slow with the posture pumps. Don't kill yourself. Don't go crazy, people, and you won't need to take pills. You know, but certainly if you're overdoing it, go see your chiropractor, maybe more often. You know, if you're getting aggressive and trying to make progress with your curves, you're going to need a steady regimen of chiropractic. So, minimum once a week. Minimum. All right. John Bergman in Huntington Beach. Dr. Bergman, he's seeing patients 2-3 times a day. And so he reports great results. So, you can't argue with great results. And testimonials, you know, the patients, anecdotal. I mean, you get 1 million anecdotal testimonials, starts adding up. All right, people, if you let me rant, I'll just promote chiropractic till my last breath. So hopefully this was helpful for you. Hopefully it will continue to be helpful for you. Hopefully we are a resource. That's what we're intending. Of course, this video is for my patients, but certainly for anyone out on YouTube or out there on the web who may be finding this, hopefully it can help you in understanding of the biomechanics of the spine and spinal hygiene, how to maintain and how to keep them healthy, right? Keep it moving. I like stretching back into extension. That's what you're going to be doing with these posture pumps. People who are stretching forward, be careful with that. That's usually a problem. I seen one lady pulling down on her neck, destroyed. The vertebrae were destroyed. All right, so don't think you know, just because you're a yoga instructor and you know, a Pilates instructor, no offense to you guys, but you have some education, you're worse. That was the lady who was pulling on her neck, destroyed. And I'm sure she had a lot to do with it. You can't pull your neck into flexion 20 or 100 times a day really forcefully and not ruin your curve and smash your discs and destroy your neck. Yes, it's called Wolff's Law. We lay down new bone under pressure. And so be careful which direction your pressure is coming from. Your neck should be relaxed on top of your shoulders and centered, using no muscles to hold your head up. Okay, as soon as you come a half inch forward, now the muscles engage. If you're engaged all day, you're going to have problems. And that's what most of the world is doing. Very few people, like 5%, 10% or less for sure, coming in with a normal curve. And very, like definitely 1% or less have too much curve. So, I mean, if you're in doubt about posture pump or whatever, you don't have a lot of money to see the chiro and you want to try it at home on your own, probably not going to do much damage or make things worse. Not impossible, like I say, don't overdo it, but, you know, if you have too much curve already, it's probably just not going to help you. It shouldn't really make things worse. You'll see. Let me know how it goes for you. I think we covered it all, people. That's it. Peace and love. Holistic lifestyle. Stay healthy, all right? Stay hydrated. And remember, avoid the 3 T's. The thoughts is the stress. Traumas like micro trauma, repetitive micro trauma, like just looking down at your phone all day. And toxins. So good luck with that. Breathe some fresh air. Move to the country. Drink some clean water. Some clean food. Yeah. That's it. I love you. See you on the next one.